Hey guys, so is it okay if we just give it 5 more minutes because it's really packed out there, and I had no idea. Is there parking nearby? Are you guys aware?
Behind.
There's a strip mall
Oh.
on the other side of the tracks.
Oh, on the other side, so they have to walk
So you
back.
just gotta
over
keep
there.
going down and you walk back.
Okay, so are you guys good with 5 more minutes? Because I don't want to irritate people by running late. Okay.
Play the movie faster.
Play the movie faster. I'm not sure if Gunn would appreciate that, the actual documentarian, but yeah. But anyway, I just want to say while we're waiting, thank you so much for coming out. Thank you for whoever brought those donations. They are very, very welcome, so I really, really appreciate it. Also, how should I put this? So many things to say. There's very delicious coffee and tea at the back, and extremely expensive cookies. All right? So please help yourself. All right? And take as many as you can. Seriously, as many as you can. All right? And also, thank you for, this was by donation only. We didn't want to charge people for it. But I'll just tell you, in the interest of full transparency, because I am all about transparency, unlike some people. In the interest of full transparency, the money that I get tonight will go to pay for the cost of the room, and any additional money is going towards City Street Outreach, which is homeless, well, a group that I started working with a couple of years ago. They are awesome. And some of, yes, that's right. That's right, Linda.
No, I think I'm pointing at it.
They're all wonderful. The 4 of them are right over there. And they started City Street Outreach like in 2000? Or sorry, 2000. 24
No,
years
I don't
ago.
think so.
In like about 2020,
Yeah.
at the beginning of COVID. And basically all that they do, I think they go, it's 5 days a week, right? Jane, it's 4. They go out 4 days a week. So I'm giving them a shameless plug, okay? They go out 4 days a week, and not only do they provide food, clothing, hygiene products, tents, blankets, like they even have a storage center at a church up in North London, as well as they use the kitchen in downtown London. They minister as well to the people. Which is sorely needed, because what these people need more than anything else is, I think, someone who shows that they actually care. And I feel sometimes that is not often forthcoming. And there have been so many private organizations that are trying to fill in the gaps for this huge community that seems to be increasing exponentially. Would you agree with that?
Yep.
And yes, Mr. Miller, do you have something to say?
Yeah, how big is the homeless community?
Very good question. Now, I think by city estimates, I think they say 2,000. Am I correct in that?
It's around there.
However, I would argue that there are more. A lot more that are not, the number is not tallied correctly. And there are many people we work with. Oh, so another thing I want to say about City Street Outreach. So no government funding. They don't get any government funding. So they basically go just by the generosity of private citizens and their donations, right?
And Harvest Hands.
Oh my gosh, that's another awesome organization. It's called Harvest Hands. It's located in St. Thomas. And what these people do is they have this big warehouse in St. Thomas, and they collect extra food and what have you, anything that's going to be tossed, even though it's still good. And it's huge. And all these organizations come to Harvest Hands, and they give them this food, and it's run by volunteers. It's all done for people who are not getting a paycheck from the government, and they spread it out to different organizations, including ours.
300.
300 different organizations. What is it, throughout Southwestern Ontario, Carol?
Southwest, yeah.
Southwest Ontario. So, okay, so I'm just gonna start because whatever. Hey, come on in! Sorry, I didn't mean to draw attention to you. I have a bad habit of doing that. I'm a high school teacher, so I really like drawing attention to the latecomers in the audience. All right, Anyway, so you might say, so why the heck is this weird person who's standing up here doing this? Well, as I said, I'm a high school teacher, and I'm certainly by no means an expert. I don't claim any expertise about this matter. All I claim is experience. So like I say, I've been doing this for 5 years, since March 2020. I've worked with different organizations, and I've just seen things get progressively worse on the streets. And I'm tired of it, right? And what I see is a lot of talk and no action. Would you agree?
Yes.
Okay, I've been to so many different homelessness meetings in the city, which is awesome, and they're extremely well attended, but again, it's the same things that are said over and over again, and I don't see any solutions, right? And one of the main problems, and I'm sure you guys would agree with this, and I believe Ms. Stevenson, our wonderful city councillor, Ward 4, is here. Yay! I believe she would agree to this. That one of the main problems is the opioid crisis, which is all over our country. When we're talking about homelessness, it's not just in London, it is everywhere, right? And many people, I think 50,000 people have died due to opioid deaths. And whatever we're doing, I believe the Safe Supply program was inaugurated as a pilot program in London, am I correct, about 2016? Dr. Koivu could also clarify this. Whatever we're doing doesn't seem to be working, right? And so I think that we need to have a discussion about that. So that's why I wanted to preview this film. I might just keep doing this and get more and more of an audience and do this again and again for all sorts of different films. Because another thing, and please forgive me if you get irritated by me saying this, but I also find that the media has not been completely forthcoming about all different sides of the problem. And that's a generous way of putting it. I don't hear too much criticism or opposing points of view in regards to the drug crisis. Or about anything, quite honestly. Is that fair?
Yep.
Yes.
And in fact, I have resorted to going to many different alternative media sources, which it turns out that this actually is one. Okay, this documentary by Gunn is an alternative media. I would not have heard about this unless I had been tuned into alternative media, because it's not out there. This information is not available to the public, and it scares me how uninformed, not because of you, but how uninformed our population is about a lot of things that are actually taking place in our communities. And I am here, hopefully, to change that, because I think, yeah, sorry, my husband's telling me I'm harping. Okay, in other words, shut up. Okay, fine. All right, we can talk later. All right, I'm only supposed to be the moderator. I'm not supposed to give my opinions. I have a very hard time not doing that. Okay, so anyway, that's my deal. Again, I'm no expert, but in the audience, we have some awesome people who are going to perhaps speak to the issues at hand at the end. And I kind of want to make it more like a discussion, right? It can be question and answer, but a discussion where you feel free to say what you feel needs to be said, okay? So we have, as I said before, the awesome Susan Stevenson, City Councilor for Ward 4, probably the most beleaguered ward. Am I correct? Most beleaguered ward. Unfortunately, she's got quite a few issues that she has to contend with, and she's doing so admirably. We also have Dr. Sharon Koivu. I'm so happy that she has shown up. It's wonderful. She is actually a doctor, an addiction specialist, so she can speak to many of these issues. I also have a wonderful man by the name of Sid Rollo, who agreed to come at the last minute. I just thought, what rehabilitation recovery facility can I call in London? And I said, oh, Teen Challenge. I thought Teen Challenge was for losing weight. I don't know why. I seriously thought, please forgive me, it was a fat farm. I don't know why. Oh gosh, see, I put my foot in it all the time. I'm on the spectrum, okay? All right, so I thought, and anyway, he agreed to come here because he wants to speak about rehabilitation and recovery, something I don't think we talk about enough.
Yep.
And I also have, oh yes, the awesome Nigel Stuckey, the creator of the wonderful document, wonderful, is that the accurate word to describe this? Where are you, Nigel? There he is. Of the documentary Atrocity, which has been screened throughout London at various locations. The latest location was at... She's telling me to shut up, too.
No, that's an applause to Atrocity.
Oh, okay, can you make it more obvious? That's beatnik stuff. Okay, that's when we read poetry. And I'm not reading poetry yet. Yeah, don't interrupt. Okay. All right. So, Mr. Stuckey is awesome. He screened his film Atrocity at Palestine recently, at which was also attended by Ms. Stevenson and another city councillor and a couple of other people. It really, and since I've been on the streets for a while and I've seen a lot, it really effectively portrays a lot of what we see on our city streets. In fact, I don't think it goes far enough, and I'm sure you would agree to that. And he's planning on making other documentaries, for instance, to show how women deal with homelessness in our community, as well as what it was like this winter. Because this winter was a disaster.
Yep.
Okay? And I didn't say, when we're talking about addiction, it automatically sort of rolls over into homelessness as well, because it's all interconnected, right? So we have Nigel, and we also have, now, Sid, Nigel, Susan, Dr. Koivu, oh, and a young man by the name of Bradley Zylstra. He's 36, but by my standards, that's young. Bradley Zylstra, he was an ex-homeless individual and also an ex-addict. He's going to try to make it, but he's in the middle of some chaos in his life right now. But we also have Sherry. Where is she? Sherry, give her a round of applause. Who is a mental health worker who actually lives in Watson Park in a tent, and she's had some...
Well,
did live, but she was evicted. That's a whole other story. Not because of bad behavior. She was evicted and I believe now is living in a hotel. And she has a lot to say about the situation as well, I'm sure. So I just want complete openness and honesty and transparency because, you know, sugarcoating things doesn't get us anywhere. Especially now. So, are we good to start watching?
Yep.
Okay, all right.
Opioids are killing thousands of people every year in this country.
More than 49,000 Canadians have died from toxic opioids since 2016.
How many of you guys have actually heard this information before? All right. Did you access it through mainstream media?
no.
Interesting. Interesting. I don't want to waste any more time. I want to get right to the discussion because it's getting late and it is a weeknight. Is it okay if I call forward the people, the lauded individuals we invited? Miss Stevenson, is that okay? Give her a round of applause. Dr. Koivu, thank you so much. Give her a round of applause. Mr. Rollo? Okay, hey, give her a round of applause too. It's not a fat bar, okay? And Sherry, where are you? Sherry. And Nigel, are you still here? Oh, he's in the back. Okay, so he'll be out in a second. So I really wanted to make this more of a discussion, an open, honest discussion. Questions, of course, are welcome. Ultimately, it's clear that this is a one-sided presentation. But I feel that we are getting one-sided presentations from alternative sources. It's about time we get this other side, right? And I really want, I think we need to take action. And at the table over there, there were these letters that were composed by an organization called CCAL, which outlined the crisis. And if you want to take action, there's a list of all our MPs, our MPPs, everybody. You can send letters to these people telling them what you think of this. I don't know, maybe you're for safe supply, maybe you think that should be done differently, etc. But I think some kind of action is necessary, and the people have the power.
That's right.
Yep.
They do.
Yeah.
All right. Moderate applause. Okay, so if you guys, I don't know, would we like to start, who should we start with? Dr. Koivu, would you like to, maybe each of you guys tell us a little bit about yourselves, and if anyone has any questions or wants to ask something, feel free. We can bring them a mic, And if you need one, I don't actually need one. So you're free to have my mic, okay? All right, so, oh, and there's Mr. Stuckey. So 3 of these individuals were in the film. Give him a round of applause. You can also check out his documentary, Atrocity. 3 of these individuals were actually in the film. I'm sure you recognize them. So Susan, Dr. Koivu, and Nigel were all in the film. So, all right. Good job. Yeah. All right. Yeah, go ahead. Sure.
Oh, guess we're going to start at the end.
Go for it.
Now it'll be working.
Yeah.
Yes, so I'm Susan Stevenson, first-term councillor in Ward 4, and I started hearing about Safer Supply when I was canvassing in Old East Village. People were telling me about the devastating effects of that in their neighborhood. I learned so much. So it was an honor to be in this documentary. I took the opportunity as soon as it was offered to me because people do need to know, right? The average person in London doesn't understand that London is one of the leading. We follow right after Vancouver, and we've got activists who publicly are saying that they support DULF, that Drug Users Liberation Front, that what they want to see in London are compassion clubs where people can go and do their illegal drugs the same way we can go to a bar and have a beer. They are openly saying that, but when I shine a light on what they're saying, they attack me because they don't want it out in the general public. In the past, it's been more just in circles of people who agree. And so as soon as I was just shining a light on what they've been publicly saying, the attacks were fierce. And I think that the public deserves, as has been said several times, to be transparent about what taxpayer dollars are doing in our city. So when we talk about the media and we don't hear about it, I can't speak for other places, but in this city we are generally Liberal and NDP at provincial and federal levels, and primarily that in the city level too. And so the media is gonna not call out who we've elected, right? That's my opinion, is I keep wondering why are we not hearing it here? Well, I think it's respectful that people have spoken, they voted, these are Liberal and NDP policies, and they are having a devastating effect when it comes to drugs in our city, and we are leaders in the country. And so when I keep hearing, oh, well, every city's like this, every city is not like this. We do not have we have activists here that are not in cities across this province. And it matters, and I think we get to know that we did start Safer Supply here, and there's a very, very loud voice for that and for these extreme policies here in this city, right below the surface.
I am Sharon Koivu. I have so much I want to say that I could spend an hour or two, but I also want to be really brief, and I'm going to try to balance that. I've been in medicine now for 40 years. In London and St. Thomas, so if you can do the math, obviously I was about 10 when I started. Actually, I'm turning 65 next week, but anyway. And I lived through the Purdue crisis. So I actually saw the Purdue crisis. I was there, and I saw, unlike what some of the movie portrayals, most of the physicians that I saw involved in the Purdue crisis were really good people that got caught up in something that they believed. The pain clinic at St. Joe's was funded by Purdue. London was actually promoted using opioids for pain. If you go to 2002, London was kind of the epicenter of using an increase in kind of chronic pain being identified and using opioids for pain. So I watched London be the center of a crisis before, which meant I didn't think I'd experience it twice. We had a really big problem in London with, not Oxycontin. When Oxycontin came off the market, we had a really big problem with it, with all the docs switching to something called hydromorphcontin, which is long-acting hydromorphone, which is the long-acting form of Dilaudid. We had a public health emergency based on people injecting Dilaudid, getting spreading HIV because it lived in particularly in this drug, hepatitis C, and a heart valve infection. One of the responses to that was the idea that if we gave people using hydromorphone, the long-acting type, the short-acting, then we could actually help the crisis. And that was, so give to sex workers the short-acting instead of the long-acting, and actually it worked. We got rid of HIV and hepatitis C as an epidemic, and we helped get rid of the heart valve infection. We didn't have fentanyl. It wasn't about fentanyl. In 2016, when we started Safe Supply, people remember living in London, we didn't have a fentanyl crisis here. It was already starting in BC, but we didn't have it here. We had a hydromorph cotton crisis, so a Dilaudid crisis. So yes, when you put people on Dilaudid, who were already on, when you put people on hydromorphone who were already on hydromorphone, and offer wraparound services, they improve. And that was shown. But that wasn't about people on fentanyl. That was about people using the same drug. So and it was also about people getting really, really, really important wraparound services. And they did improve. But evidence of improvement does not negate evidence of harm. And the one thing I like to compare to, although I'm definitely showing my age with this one, although I wasn't in medicine at the time, but there was a drug that really, 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 evidence-based, helped nausea in pregnancy. The best drug, absolutely evidence-based to help nausea in pregnancy. It definitely worked. And nausea in pregnancy is serious. It can lead to dehydration, it can lead to, it can even lead to stillbirths, it can lead to intrauterine growth retardation, so it can have major medical complications. So having a drug that will help that is a good thing, except that the evidence-based drug is thalidomide. And thalidomide really worked, but it also caused severe limb deformities in children that were born with mothers taking it in the first trimester. Not in the second or third, but the first. But we recognized the harm was enough that we stopped prescribing it altogether. In 2016, I felt the harm from hydromorph cotton warranted the experiment. I did. And then I started watching what was happening, both as a physician working at London Health Sciences Centre in palliative care and addiction, and a resident of Old East Village. I had moved into Old East Village in 2015. I actually at the time knew it might be a place where there'd be a supervised injection site. Whole other story, don't want to get into it tonight. And what I started seeing, so for those who lived in Old East Village, we didn't have any encampments behind Chapman's when I moved into Old East Village. But I started seeing so many things at work. I started seeing people getting infections, different type. We had a significant increase in infections related to injection drug use, particularly spine infections. And when I talked to patients, because I did that forever, I was finding that they were injecting hydromorphone, Dilaudid. Now, is it the pill? Is it how they were using it? Some of these people were absolutely living in apartments and clean environments, not just in encampments. But I also started seeing people moving behind the pharmacy where a lot of diversion was taking place, or at least that's what they were telling me. That people would get their script, go out the back door, sometimes really early in the morning, and it's cheaper really early in the morning, and it's cheaper if you live close by. I had people who were housed that were moving into encampments to be able to get diverted drugs cheaper. And they would tell me, and I lived in the neighborhood, that, to buy the drugs did mean, like, every morning at 3 o'clock in the morning, you break into every car that's open, and most people didn't smash windows, but crime increased and things that went along with that. But then also vulnerability. People who were prescribed drugs, I saw being very vulnerable to violence if they didn't give up some of their supply. To sexual violence if they didn't give up some of their supply. So I started seeing things, and I think of all the things I saw, as was mentioned in this film, as the price was going down, I saw people who had never used opioids using opioids. They were cheap now. It's easier. If you're 15 and you want to get high, if you smoke weed, everybody can smell it. If you have a six-pack, it's hard to hide it. It's really damn easy to hide a bunch of pills in your pocket and your parents don't know that that was your gateway. But then once you're using it, you want something more and more, and you want something stronger, and then you start using fentanyl. When I started in my work, most of the people I saw were started with prescription, and that was what got them addicted, so during the OxyContin days. And most of those people had very significant trauma, intergenerational trauma, sexual trauma in their youth. That shifted to people getting it off the street recreationally, a huge shift. Younger people, as was mentioned here, a lot more, particularly men, but a very different population, and younger people using. When I started first being public about the concerns I had, as Susan mentioned, it wasn't I was expecting, because when we first said hydromorphine was causing HIV, we were told we were lying because that couldn't happen. And I thought, okay, we proved ourselves, this won't be a problem. When I went forward, I have never received bullying to that degree. I mean, when you write, bullying is sort of a little bit, I don't know, for lack of a better word, silly, but I was actually really surprised at the backlash of just trying to say the concerns I had, and even the sort of belief that I had to somehow prove it. I mean, if I saw a side effect from a drug, it was a requirement to report it, and all of a sudden it became a requirement to prove it in a way that I'd never seen before. And I didn't get any funding, like, I didn't get the $6 million to back it up. I just had to be able to say what I was seeing. And I saw people become addicted that I believe wouldn't. I saw suffering that I really believe was related to having more drugs on the street, and that brought fentanyl. Hydromorphone here came first, and fentanyl came second. It brought it, it increased the use, it increased the homelessness, it increased the encampments, it increased the infections, it increased the trauma, and I have not seen a societal improvement from this. There can be individuals who have benefited, and I'm not saying they can't, but I also believe they would have benefited if it had been a better drug, or at least witnessed, so that they're not giving it out. I had patients who were receiving 40 pills, and when we had them in hospital witnessed, I had one guy who was getting 40 and he could only tolerate 2 in a day. More often it was about 12. But there was a huge gap between what they could tolerate and what they were being prescribed. And to me it's tragic to watch lives being ruined by opioids and to continue to see it over and over and over again. And to cry out to the people that you think, I actually assumed that the politicians would listen and the media would listen, and I was surprised. I was really surprised. I grew up in a really left-wing family. Tommy Douglas was a friend of my dad's. And then I went through kind of a liberal phase. I was expecting that the place where I grew up would be where I'd be the most welcome to speak. And I was shocked when I found that they weren't listening. I've spoken to every media who will. It doesn't matter what political persuasion someone has or whatever. This isn't about politics to me. This is about suffering and lives being harmed. And I do believe that public opinion can sway the government, no matter what government comes in next. I'm not worried. I feel like I'm not worried about who wins as much as I'm worried about the public opinion making sure that the message is out that this is not okay. And it doesn't matter to me who wins. We need to be able to say to our politician, this is not okay. I said that to our MP when I was living in Aldi's Village, and he listened to me until he didn't. And that was a real shock too. But anyway, that's a different story. So I'm really glad, actually I was exhausted today, I wasn't going to come, and I'm glad I came, because I hadn't seen that movie before. And I'm glad that people are talking about it, because when I did live in Aldi's Village and I was seeing what was happening, unfolding, and knowing what was happening, the village didn't know. They were blaming the supervised injection site on things that were happening. That's a whole other story. But they were blaming it on things that were happening that I knew were related to diversion from safe supply. People weren't aware of what was happening in their own backyard. And unlike, say, supervised injection sites where there were a whole bunch of town hall meetings, nobody got a notice. You didn't get somebody knocking on your door saying, this is happening in your neighborhood. And I think that, It didn't allow people the opportunity to say, this is a problem. And my last thing I just want to say is that when we normalize things, we know kids are more vulnerable. We need to have, I agree with the pillars, and I think they're really important. There are 4 pillars in addiction. Prevention, which we have forgotten. Prevention includes access to parks, access to play. But we know from our tobacco work that prevention also means if you normalize something, you're more likely. So we stop people from being allowed to smoke near a playground, but then allow them to smoke fentanyl near a playground. That does not make sense, because normalizing something does increase the risk, and there's a whole bunch of other reasons why drug use increases the risk. And if you are in recovery, you're trying to get there, seeing it is a nightmare. I have family members of experience who were in recovery, and by witnessing drug use on the street, relapsed. And fortunately had good families and had a good environment where they were able to get into recovery. But you have really good families. It's not about that. It really is about when you're immersed in so much drug culture, it's really hard. No matter how much you want it, it's really hard to be able to get into recovery. We have to do things differently. So thank you for coming.
Hello there. My name is Sid Rollo. I work for the Teen Challenge Drug and Alcohol Rehabilitation Program. I've been a counselor there for 17 years, and recently I've become the director of the program. And I grew up here, actually, in this area, in London. My mom, my brother still live in this area. I do, first off, want to say thank you to Tanya, with a J, for putting on this video. It was rather disturbing and shocking to me. I really wasn't aware to the degree that things had gone. You know, being in addiction, harm reduction is one of the pillar, and I've worked with some people where harm reduction actually kept them alive and got them into treatment, and they're still alive today. They're in recovery. We have a couple of people work at our program who harm reduction helped them, but I mean, clearly harm reduction has lost its way, and even they would say they didn't really get the help to get off harm reduction. It's really they wanted to get off of it. One fellow was on for 14 years on it, and every time he wanted to get off of it, they really encouraged him to stay on it. And so, and that's really the purpose of harm reduction, is to help someone to get into treatment. And so, anyways, I'm here definitely to learn and share and see what questions you guys have. Thank you.
Hi there, I'm not so much here for that aspect, but here on the other front of homelessness, and as we all know, is a very close knit family with the others. And if our world and our government and London and other cities are failing at one thing with addictions, they're also failing at another thing, which is homelessness. And there's too many people going unnoticed right now, and too many parks being evacuated and stuff being stolen from them for the things that they have left. And unfortunately, that also brings them back into a mental state of falling into opiates or other things. So I'm here to learn and give my feedback from what I've been experiencing for the last year now, and pass it on to this amazing man here.
Hello. So my name's Nigel Stuckey. I'm a retired police officer, 32 years. My last 5 years on the force were frontline supervision, which I'd done before, but every time you come back to the street, it has a different flavor. There's something different. And this was just when the opioid crisis was happening. And, you know, one of the things I did mention in the film, and I've spoken about quite a bit, is that, you know, even among the emergency services, I was seeing fatigue. There were times in London where it was every hour going to an overdose. And you knew when there was a bad batch, and we would be just going call to call to call. And, you know, I can't tell you how many times I'd have discussions with people and they'd say, no, I didn't take anything. You know, 2 minutes later they were completely passed out, and then they were revived. The best thing I can give the analogy, it's like seeing somebody being hit with a baseball bat in reverse when you give somebody Narcan. They are on the verge of death, they are circling the drain, they breathe like once every 45 seconds, and then next thing you know, they're arguing with you. It's just something else. So the film, I became a documentary filmmaker. It's something I want to do. Has anybody here seen it, or a couple of people, or? So a couple, okay. So I think you'll know from the film, I tried to take a look over the mountaintops, if that makes sense, in respect to homelessness, mental health, and addiction. And I was very, very conscientious not to get pulled in valleys. And boy, Safe Supply is a big valley. And I was trying to have a measured response to it. For those that have seen the film, you'll see that there is a couple in there where the gentleman says, you know, Safe Supply saved my life. Later in the film, he says, you know, we ran into problems because we were being accused of being diverted it. So I see both sides of that. And I do see that some people have benefited from Safe Supply, but I also really struggle with the whole idea of people being provided really vulnerable people who are desperate, being provided drugs with no supervision. And that to me has never made sense. So the film does deal with really homelessness, and I just want to talk about what you mentioned just quickly, is that, that is, if you have somebody who is experiencing homelessness and they have a cart, that is their life support, and that is what they need to survive. And then they, just being separated by that cart or having their belongings taken from that cart can be so significant in their lives. And I will say very openly that my paradigm changed in doing the film. I don't think I had a negative, or maybe a little bit, but I think, and I'm very open about this in the film as well, but certainly I see very clearly both sides now. I see the complexities, and I see really now, without lived experience, like I can never speak on that level, but I can say, I can really see the challenges that people who are experiencing homelessness are facing, and they are in an absolute survival mode. Now the new film, which we're working on right now, which is almost finished, is on the life of Cheryl Shelvin. And that is specifically dealing with women on the street experiencing homelessness and specific vulnerabilities that they face, and one of those specifically being sexual vulnerabilities. And Sharon has graciously agreed to be in this film as well. And we're talking in this film about crystal meth, not fentanyl, and how crystal meth is being used as a drug by women to stay awake at night, so that they don't become victimized sexually, or having their property stolen. So, boy, it's really, we're over our head.
Thank you very much. Okay, any questions or points or what have you? Okay, John?
Wow. I don't even know where to start. I started off with a question. And as I listen to this, I'm just totally overwhelmed. I'm new to London. I've been here about 2 years. And when I first came here, I'd go down Dundas Street with some friends, and it was a pleasant experience. Now it's absolutely horrendous. I can't believe what I'm seeing on the streets. And I can't believe that people in power, politicians or whatever, are burying their heads so much. Like, we have one councillor here out of what, 15? Are there any people that are running for office here? No. Hopefully, yes. Are there any sitting politicians? Yeah, just running away is more like it. So, I guess I don't have a question because I just don't know where to start. And if I could formulate one, it would be, where do we start to deal with this issue? Are these people all paid off? All the politicians, are they going to be paid off to look the other way? I just don't know.
One of the things that is this on? What do I do?
Yeah. Is it on?
Okay, I don't think it's on, but that's fine. What?
It's on now.
Okay, that's fine, I can just talk loud. Let's be really honest about the City of London. If they were sitting at a poker table, the City of London politicians have been dealt a very poor set of cards. And that's because of the lack of strategy on a provincial and I would say more provincial, but also national level. And certainly, the unintended consequences of what happened in this province in respect to mental health treatment where, you know, when I started policing, we would bring folks who were suffering from mental health problems, and we would bring them to London Psychiatric.
Yeah.
And they weren't locked in. They could go out during the day, and they had a safe place. And then we said, well, no, this isn't humane. And then we said, we'll provide supports, but we didn't. And so that's why in Atrocity, I very specifically, you'll see in the film, there is a man who, you know, it's pretty obvious he has some mental health challenges. He's talking about Area 51. He's talking about some other things. And he's living in a car park. You know, that's where he lives. I have contact with several of the people from this film. So I ran into him about 5 months ago, and he was housed. He was at one of the missions, and now he's out again, and he's back on the street. So here he is. Here's a man with some really, you know, some significant mental health issues, who's living in car parks, and who's using fentanyl to self-medicate, okay, to deal with his untreated medical problems. So it's not the role of the City of London to provide medical resources. That's a provincial level. Yet they're in a position where you're having to do that to some extent, if I'm not mistaken, right? With, you know, these hubs and the plan. So, you know, some of these problems, I just think really, when people say, what's the answer? Let's have a real national and provincial strategy that deals with this crisis.
Yeah. I just have a person with the mic here.
Hello? Okay. I have a question. First, I would like to respond to that. It's been 20 years since the psych hospitals closed, and we've had plenty of politicians since that have done nothing. So I think we have to accept that it's a 3-level of government solution. We can't blame everything on the province.
No.
We have a municipal government that gets the money for these programs, and that's my question to the one city councillor. You have been very vocal on the problems in London. How do we get the other councillors and mayor to watch that movie and to have a discussion with us? Because all I see is you and Dr. Koivu. I've heard you many times, and I'm sure you must have contacted the city. You must have contacted the mayor and told them what you thought. I'd like to know from both of you, have you gotten anything in return from voicing your concern? And what is the answer? What do we do? We talk about compelling federal politicians and provincial politicians, but this is happening here on the ground in London and in cities across the country, and the money has been given to the municipal government. It's the municipal bureaucrats that created the whole of community response, along with the activists that have been rolling out the problems that are destroying this city. That's not the province. That is the City of London. So I would love anything that you have to offer from the municipal side. And Dr. Koivu, I'd love to hear if you've ever contacted the city or the mayor and let them know how serious this is and what the response was.
So, great questions, and no question, you know, with the psych hospital, I heard that all the time when I was canvassing, and we did get what we got. But what we do matters, and the choices that we're making matters, and although, you know, I don't believe that municipalities should be doing healthcare, sober housing would be great, a sober shelter would be great, a pathway for the people who are brave enough to go to detox, to allow them an opportunity to experience a city where they're not being triggered and seeing open drug use, I think would be a great thing. In terms of the response that I have had when I speak about these things is formal reprimands and sanctioning on my pay. So, this happened right from the very beginning. Like when I was canvassing in summer of 2022, we had a hunger strike on the front lawn of City Hall. Then when we got in, and it's a big long story when Tanya says, where do we start? Or somebody said, where do we start? The gentleman at the back. I think awareness is the first step. So I think Nigel's documentary, I think people coming out and watching this, I think bringing awareness to people, because most people know there's something wrong, but they don't know what it is. So whether you agree with this documentary or atrocity or agree with parts of it and not others, doesn't matter. I think people becoming aware and talking about the actual issues, because we're not talking about them in the media and municipally. So how can we create more of these spaces, more dialogue, get the word out, and then it becomes unstoppable to a certain degree, right? The city will respond when the public moves. We've seen that. We saw it with the hunger strike. But the people leading that hunger strike were activists like we were seeing here. And they are leading this, and politicians at every level were not invited to that table. In fact, they couldn't stop us from going, but we were asked to not attend. So the people of London were not there, and the politicians were not there at any level of government. And then we don't get anything as councillors that isn't public information. So people think, oh, well, you're a councillor, you must get to have information. No, I've spent hundreds of dollars on freedom of information requests just to see some of these contracts. And one of them came back fully redacted. So there's lots to share, and I think, yes, we do need to speak to our politicians, but in a way, in an educated way. I think awareness is the first step.
You have a question, maybe for all of you, if you can answer it. Sorry, I have a question.
Well, I think Dr. Koivu just wants to answer.
Oh, sorry.
Yeah,
Sorry,
that's
Sorry
fine.
about that.
Sorry.
That's okay.
Thank you for that question. And yes, I wrote the mayor at least a few times. I've written the people that are specifically in certain wards that are affected by this. I would say that the response I've had has been kind of, thank you for your letter, that kind of response. And I think that there's so many things I agree awareness, and I think making sure that there's not just one voice that's being heard by the politicians, because I've sort of, there are certain agencies and people that are invested in giving out a drug, having people addicted to that drug and then addicted to the program and addicted to them. And that can affect transitioning to recovery. And if that's the only voice, then I don't think they're hearing, it's sort of like hearing that thalidomide's great for nausea and not hearing, the side effect ain't worth it. And I feel like that's what they're hearing, is that it's good, but they're not hearing, but maybe the side effect, maybe the unintended consequences are so harmful we have to rethink it. And all they're hearing is, but it's so good. But they're not hearing, it's so good because you can sell it and make a profit. I remember early on calculating with one of the physicians in London that one of the people that we both knew was probably making $100,000. This is before fentanyl was a big issue, and she was selling it, and was probably making about $100,000 a year from selling her prescribed drugs. Can't make that much anymore because they're not worth as much, but it really was about not understanding that, when you ask her if she's selling, of course she's going to say no. I mean, it's not how you do science, it's not how you do research. And she's dead. She died as a consequence, although she's not counted in any consequence. She died as a consequence of side effects of her addiction that she was prescribed, medication she was prescribed. I think that it's so important to have more voices and more voices out there, because when there's a paper saying that if you're talking about diversion, you're creating moral panic. And it's published, and one of the city councilors that isn't here, I saw, I'm not on X, but I saw him thanking the people making this report that, saying diversion is bad are creating moral panic. So I've been called a lot of things, and moral panic may not be the worst thing I've been called. But it doesn't generate the type of response we need. We need to have a response that we recognize that there's so much, this is very complex. We also do need to start, at every level, municipal, provincial, and federal, recognizing what we seem to have forgotten is that there are 4 pillars. And that they need to be collaborative and coordinating. It doesn't mean you just fund one pillar and a different pillar and a different pillar. We put, as was pointed out here, I think harm reduction was not getting enough funding, and then became like overcompensated and gets so much more, but doesn't coordinate necessarily with recovery and moving into it. When we first started talking about supervised injection sites in London, I was at the town hall meetings, I was on the committees, you can read the papers, I'm in there. And it was about having an introduction into getting help and then moving into recovery, not stopping there. And I feel like that we've lost sight of the pillars working together collaboratively and in a way that makes sense. And it doesn't mean all the funding goes to one or that they're equal. I think we need a lot more in prevention and a lot more in treatment. But we also need to recognize the importance of harm reduction and enforcement in a collaborative way that makes sense and adjusts to the problems that we're seeing and the problems that we're facing. But to do that, we have to start recognizing that, I heard somebody talking about how, taking money away from harm reduction is sort of this political, horrible thing, but if you have all the money and you're trying to balance, it needs to be a balance to that. But I also think that all the money in having just treatment and not the other 3 pillars is a problem too, that they need to be working together. We need to start getting together in a collaborative way to recognize what we learned and then implement it, and we're not doing that.
Okay, thanks. We have a question right here.
Yeah, I have a question. It's a two-parter. Number one, so the safe supplies pretty well are geared towards the larger center like London, Woodstock, St. Thomas, whatever. Are they expanding out to the rural areas? And if they are, or if they're not, is that increasing the problems in London area where you've got people coming in to where the safe supply is?
Actually, I would like to make one thing I meant to say when we were talking about municipalities is that I work in both here in London. Well, I don't work here anymore. I can tell the story of why I don't, but I won't right now. And St. Thomas. In 2014, St. Thomas had a higher overdose rate per 100,000 than London did. Now it's significantly the opposite direction. London is significantly higher in the overdose death rate, so per 100,000, than in St. Thomas. And particularly has really increased, that difference has really increased since 2019. And I think that what we're seeing is a very different approach to the opioid crisis, where in London particularly, has had a much more harm reduction based approach. St. Thomas didn't get a supervised injection site or safe supply yet. It's very lucrative, so I can't say it will never come. So they have put an emphasis in a different direction, particularly towards housing first programs that also teach people how to be in houses, because if you haven't been housed, knowing skills about living in a house aren't necessarily intuitive. And a treatment program. So I'm watching in real time different municipalities having different approaches with extremely different results. But as to your point, yes, there's probably some people from St. Thomas. Actually, I work in the hospital in St. Thomas, and it wouldn't pay the bills if I was just working with seeing people with addiction compared to London, because it's just so dramatically different. And when I do see people with infectious complications of injection drug use, they usually come from London. So yes, there are people from St. Thomas, I'm sure, that have come to London to get safe supply, and some of it's even there. But there are also people from London that have gone to St. Thomas, stayed away from it. And to be able to get into recovery, to be able to get away and step back. St. Thomas isn't perfect, but I've certainly, and it has some problems. But the difference is palpable. When you go down Talbot Street, it does not look like Dundas Street. And so the ability to get into a recovery program, so I'm seeing people go go that direction. Safe supply has tended to be in larger centers, but I think that one thing that's really, really tricky right now is knowing where it is, because safe supply funded programs, London had a funded program, it's funding in Ottawa, funding in Peterborough, but anybody can start it, and you don't have to identify yourself with, any physician or nurse practitioner can start prescribing a safer supply type program, and that's what we see in London, that it was one program's funded, but there's 3 others that aren't. Anyone can prescribe, you don't have to report to your college, you don't get listed as being a prescriber of safe supply, there's no fail-safe mechanisms of making sure you have wraparound services or that you're looking for a diversion. So to be able to know where it is actually really tricky. Hamilton has a huge safe supply program, but I don't think they have funding. And so really being able to know where it is can be very tricky, of just being able to know where and to find where the prescribing is. So just stopping the federal funding is not going to limit safe supply. It really has to be at a different level, where we have to start looking at whether programs are witnessed, how we identify it, how we identify who's prescribing, how we identify who's receiving, and what happens in those communities. It's hard to follow something when you don't have something that you can easily measure. But when I did measure, because I had to do this for one I was asked to be an expert witness. When I actually looked at where I could tell there were safe supply programs in communities, there was more likely to have an increase in overdose deaths and not the other way around. But as I say, it's really hard to follow because we don't track this. So that's at a level, we need to have it tracked. We need to have more than just federal funding discontinued. We need to look at, move it. We need to look at what we do now, because just dropping it's going to be like the opioid crisis in the Purdue days, where we stopped prescribing, everybody turned to the street. We need to have an exit strategy, whether it's moving towards witness programs, certainly we need to, right now, there are treatments like Sublocade and Suboxone. I won't want to go into too much detail on that, but they're not, if you're not covered on a drug plan, you don't necessarily get life-saving treatments for a crisis that we know we have. So we need to make sure that all levels and it is something at a municipal level, a provincial level, and a federal level, but it's very hard to say exactly where it is. Long answer to you.
Okay, Renee, and then.
You had 2 questions, didn't you?
Oh, did you have another question, sir?
Oh, no, she answered it.
Oh, okay.
That's good.
Thank you. That was part of the 2-parters.
Thanks.
I'm known for that.
Well, I've been documenting what's going on with the homeless at Watson Park and Maitland Park also, and in different places. And now we're talking about the drugs and how it affects the people. But there are some homeless in the city here that are not necessarily onto the drugs. And they're living in the tents because they were one step away and something happened and they fell through the crack, and now they're living on into the parks. Now we have a big problem in this city, and it's with the abuse that the homeless people in the parks are receiving from the city itself, from London Cares, especially the CIR. The CIR are terrorizing and they are harassing the homeless in their parks. All right, they have all kinds of little programs of what they do, but they actually go there and they terrorize the homeless. All right, so they actually go there and they'll steal everything that they have. They'll take it away from them. Now the homeless, I've seen homeless walking away from what they had, the little shelter that they had in this cold weather, walking away with a couple of bags of stuff that they could carry. And the rest of it is taken by the CIR and it's thrown away. My question is, Sherry, could you explain to us what you have just experienced and how you're having a hard time getting your stuff back, please?
Well, I'm not on.
This one's working.
Well, I've been down there for a year now, and I ended up down there because my foundation of my home was crumbling beneath me while I was fighting cancer. Now, I'm not here to spill about my health concerns. I'm better. I'm living on. What I'm here to do is raise awareness of what the city promises, I guess, and just doesn't want to do. Now, as Renee was saying, I have lost everything. I was given a notice stating that I had until the 31st to have my debris cleaned up. Now, debris to me would be garbage, not my personal belongings, not my animals, nothing like that. Not my shelter, especially not my shelter. And on March 27th, not March 31st, this is, March 27th, they come in with a backhoe and wouldn't even recognize that I needed a couple more hours just to get all my stuff out of there. And I have many videos, it's up on Facebook, stating that I was in direct violation. But not once did they list on any form that they hung on a tree, not handed to me, hung on a tree, that what the violation was. They're constantly changing the rules of the encampment, so I could have a piece of paper from 2004 and a piece of paper from 2005 with two different sets of rules. Nobody's telling me which one's stone. If I knew which one was stone, I'd obviously followed by them. It's not that we don't understand that we don't want rules, we do, but we also know that this isn't a permanent situation. Unfortunately, at that time and at that moment, it is for us. I guess I have a question for Sue. And Sue, after today, I applaud you for everything you went through this afternoon. But I guess the only question still on my mind is, where do I get my receipt to get my stuff? Because I went to 4 different people, if not more, in city council, or city office today, and they all couldn't tell me what to do. Except, here's Deb's number, here's Deb's email. I've done that many times. I have 30 days to collect my stuff that I will never ever be able to replace. Even though I know it's damaged, I'd still like a chance to try to get it. And I'm on the 22nd now. I have 30 days. So I guess that leaves me 4 more days to obtain this receipt from city. So where is it?
Thank you for being here. I know we've chatted about this, and you know, I think it's better for me to work with you tomorrow offline. I did read the rules on it, and there was something about if they were storing it, you'd get a tag or something like that, but I'm not sure. But it'd be good for you to get clarity on what's possibly available.
Now I have another comment. Doing the documentary that I was doing down in the park, they're protected, the CIR and the London Cares are protected by the London City Police to actually terrorize and harass the homeless. The London Police have trespassed me out of the park because they don't want me to document the crimes that the city is doing down into the park. They haven't given me a reason why I've been trespassed. It's just that I've been trespassed out of every park in the city indefinitely, out of every municipal parking lot in the city indefinitely, all right? And what they told me they also gave me a $100 fine, and my $100 fine is because engaged in conduct that could reasonably be considered offensive. Now you guys figure out what that is. This is coming from the City of London, okay? So what they've done now is they've shut me up that I can't go and document the crimes that the city is doing over there. They have pushed me away and out of it. If I go there, I'm under threat of arrest.
And I know, Renee, we've talked as well. You know, there's a lot of very high emotions, and understandably, right? Talking about people's lives here. But I do, as a city councilor and a member of the police board, I just have to say, like, the words about crimes and terrorizing, it's tragic what is happening in our city, for sure. I'm not going to argue that. And I can't say too much to what you've said there, except to just watch the language, because, you know, the CIR, and they are doing their job, right? So I mean, ultimately, I think council is responsible for this, right? Like, ultimately, the people are gonna hold us accountable, and ultimately, we are, and we need to engage in what is a very difficult situation with very complex solutions, but I really think that it's incumbent upon us to get more involved in this and do what we can to help. So, you know, I can't make any other comments there.
And I understand that, and I respect you, okay? I think you're a good politician, so I really do respect you. The problem is here, though, is that the council is not down there to see what's going on. It is not down there listening to the women that are crying under stress and what's going on. Not seeing the homeless and what they have to deal with, and the horror that they live in. They go to bed at night in the cold tent. They're not allowed to have heat in there. They're not allowed to have fire. The city is stealing their generators, so they can't have heat. So what kind of sleep do they get during the night when they have to worry if tomorrow they won't be able to where are they going to sleep the next night?
I'm just going to, is it okay if I just stop it right there? Sure. Renee is making a lot of very, very legitimate points, but it's sort of veering off topic. Yep. And I think what Renee is talking about deserves an entirely separate meeting, because this is an entirely separate issue and it's extremely serious, because I've been witness to it myself. But is it okay to just move to the next question?
Yeah, no problem.
All right, this is, I'm going to make a couple of observations and then direct my question to the Director of Teen Challenge. I'll never forgot when somebody, a politician actually, at the time, and it was a person known in City Hall, told me that what one homeless person said to him at the time, "You've given me everything to live with, but nothing to live for." And I want to bring this around. I'll give you a good example of the need for addressing the mind, body, and spirit. Everything is right so far has been mind and body. The spirit, years ago, about maybe 10, I can't remember, Don, what was it when we were doing that, the farm? About 10 years, it was a half a dozen of us. For 3 years, we met every month, did a ton of research, went to training out of town, learned all about, what I discovered was in Europe in particular, but that was spreading to the States at the time, was that they come under different names, but basically rehab farming. Little hobby farms where people who have been traumatized could go get their hands dirty, and when they start growing things, how healthy it was to the body and spirit. And we had done a lot of research about this, and we were prepared to build, to buy and build a farm like this just outside of London. We needed some capital, but it would have been self-sustaining because of the people staying there would be perhaps getting some government support and growing their own stuff for animals and stuff. The farm never did get off the ground because the people in the city said, well, you're building it outside the city, so what concern is of ours? And the people outside the city said, well, the people that are going to come and stay here are coming from the city out here, and we don't want to help the people in the city, we want to help the people who live in the rural parts. So it was kind of a catch-22. So we weren't able to get anybody with oversight to see the benefits to the city and to the farming communities. But we did, we had a huge business plan and all kinds of research. I went to, at one point, we were making a presentation when they were doing them at the, I don't know if anybody's been there, at the Lamplighter in the big ballroom there. They were doing a number of, each year they would have a different aspect of helping the marginalized. Anyway, one year they, I don't know if it was the year we were doing our presentation, but They had all the different people who were helping the marginalized in any way, that's on the streets or in the institutions, and they were all making presentations about how they were helping the marginalized. And one lady who was into research, she got up and she said that, and I was so shocked, she said, to help the people who are on the margins and grasping for help, she said, research has shown that that support groups do just as well as the professionals. I couldn't believe it. I had to sit down at her table at lunch and say, did I hear you right? Support groups can do as well as professionals? And she's talking doctors, social workers, all kinds of professionals that help people. And she said, yeah. I said, are you counting like AA and these religious support groups? No, she said, if we added them in, and what the Salvation Army does, that would be even stronger. But she said just basically people helping themselves in small communities worked as good or better than professional help. I was just shocked by that. In the end, I think, and a lot of that is because in support groups they do look at the whole mind, body, spirit. Anyway, so my question, and I'll direct to you, what can you tell us about, what's your comments on what I have said?
Well, thank you for the question. And yeah, I would agree, very accurate. Just a couple things. I mean, first off, I want to encourage anyone to seek treatment if they're struggling. But there's two things at our center, and most centers, some centers have this, but not. But one of the addiction specialists, Terrence Skorsky, one of the things he talked about in treatment is having a work therapy program. And so at our center, in terms of work therapy, kind of what you're talking about in terms of the garden, we do have a garden there. The clients take care of the garden. We have a kitchen. The clients cook their own meals, or there's a kitchen staff, but they cook for the rest of the students. They do their laundry. There's a couple guys who do the laundry. Everybody brings the laundry down. There's facilities. We have some woodworking. So there is power in that, right? And I agree 100% with community. That's why it's a treatment center. And so everybody is living with the community. And within that community, we have to find a way to get along with each other. And we do have, like, I'm a certified addictions counselor there. But, a lot of the guys will tell you, and it is very much true, that, the best thing about the program is the guys, and the worst thing about the program is the guys. And what they're saying by that is that they're doing life with these other individuals, and addiction strikes everybody, so there's a variety of individuals in the program. And through that, generally, it's a one-year program. Generally, by the end of it, I often ask them kind of 4 questions. What was your best time in the program? What was your worst time? What was your funniest moment in the program? And they have answers to those questions, and they talk about that, and it really has an impact on them. But I agree, in terms of community support, for sure, it has a big impact. I don't think you can get out of addiction on your own. And I can even see, like, even in my own marriage, my wife comes from a very tight-knit family, and that really helped her make some good choices in her life. And I came from a more dysfunctional family, and that really impacted me, surrounding myself with people that weren't looking out for my best interest, making some bad choices, getting in some bad decisions, and fortunately, other people getting in there to help me out of that. And the other thing too, a lot of people in recovery will say is that if they're able to make it to recovery, they'll talk about the fact that there was somebody in their life that never gave up on them. There was somebody that stuck it out right till the end, no matter how bad things got. And so, but yeah, you're 100% right. Yeah, community, staying within that is crucial for recovery. Yeah, thank you for the question and the comments.
Thank you. I just want to be very respectful of your time. How many more questions are you guys willing to? It's almost 10. So I just wondered how many, there are a couple more questions. Should we just go for 2 or 2 more questions?
I just have to say quickly, sing the praises of Teen Challenge.
Oh yeah. Okay.
And I didn't think it was weight loss, but I did think it was just teens. And it's men of all ages, and they run their 12-month program for $52,000 a year, and the client only has to pay $1,000.
Wow, $52,000 a year.
Yeah, $52,000 a year versus our $100,000 a year hubs, right?
Right.
So check out Teen Challenge. They have a gala every year. I'm going on Friday night, and I just can't say enough good things. Yeah.
We'll get you an invitation.
Okay, send it to me. I'm waiting for it. I'll hold you to it. Okay.
Teen Challenge is amazing, I just want to say that.
Thank you.
My question to you, and all of you, I guess, what kind of treatment programs are out there right now? Because I have a relative that is going through one. It took him a while to get in. And it's just like any hospital stay, you know, you have something you have to have operated on, they say, oh, you got 5 months. Well, but we put you on the list if we can. But with addictions, it doesn't work that way. With addictions, they need programs now. So what I want to know is what is available right now in London and the surrounding area. I mean, I know some of them because we work with some of them. But is there some way that we can start making people more aware? And obviously I've listened tonight. But how do we get more programs? We need them desperately. And just to put a cherry on the top of that, I think everybody that's still left here has to realize that the elephant in the room is it all starts with the family. So if we are going to go back to our heart, and our families, and start taking care of each other again, it's not going to get better. I mean, all of these films are great, and what you're doing is great, but if you don't have anything in there about faith and love and God, there's a whole piece of the puzzle gone.
Can you answer about how many places? I don't know.
Maybe, can I start and try? I think first, actually, I'm glad you brought up families because as I was sitting here, I'm thinking that the forgotten piece in this is families are all affected, it's interconnected. I started my work in addiction at the hospital when I saw my first patient with a heart valve infection from injecting hydromorphicon. The same time, one of my sons had a significant, actually at the time he had a crystal meth addiction. And he was one of those people, he was seen in a hospital in Burlington. He was completely psychotic. I went to see him, I thought, oh, no problem, he'll be kept in hospital, I don't have to worry about it, they'll keep him there. And that was the Monday of Civic Holiday Weekend, and on Tuesday when I went back to work, they discharged him because they just deemed he could be discharged, and wouldn't even let me get there to get him. They discharged him before I got there. Fortunately, he waited in the waiting room. I took another son with me in case he wasn't there because I was afraid of what I might do or say. And I was a physician. At that time, I was a palliative care physician, and I couldn't even get the decency of having them keep him in hospital till I arrived in Burlington from London. So I've been the mother, I've been the mother-in-law, I've been many people in this journey, and all of them inform why I'm doing what I do. And every time I almost quit, because I can tell you, working on this gets exhausting, I go back to my son, who's doing so well. And he, actually driving here tonight, I called him, actually sort of about a different issue. I told him what I was doing, and because we have a health problem with, that has nothing to do with addiction in the family, and it's been draining, and I didn't want to come tonight, and speaking to him made me come. And I realized he had that person that never gave up, and that, so did my, and I've been there for relapse. I have a daughter-in-law who's had intergenerational trauma, and she had a relapse when she saw public use, and when she had an emotional episode. And I've watched what that's like to have a relapse when you're not expecting it, and you now have kids in the involved, and by that I mean my grandchildren. So I've been there, and it's complicated, and families need support, families need recognition, and families need hope and support. And acknowledgement of what they're going through, what they're feeling, the loss they can feel, that you can actually sort of accept a death because you get so used to it. The phone rings at 11 o'clock at night, maybe it's the police telling you your child's dead. So back to the other question, which is sort of different, which is about what is there, and there is not nearly enough in any way in this area. But what we do know is, yeah, when people decide they need, there is sort of this window we do talk about when people are ready. There can be lots of reasons. Sometimes it is the overdose. Sometimes it's the stabbing. Sometimes it's just wanting your kids back. Whatever it is, we know that when people start saying they want help, that there's a window, and if you miss that window, it has to start all over again. And we know that. There's a for opioids and alcohol, one of the best places to meet from a medical perspective, and I know it's more complicated than that, is the Rapid Access Addiction Medical Clinic in London, which is part of Addiction Services Thames Valley, because there are biological and neurochemical changes that happen in the brain that do need, often for many and most people, need a medication that will address that, such as opioid agonist therapy, in conjunction with other treatment, and absolutely, I think this, hope and purpose and value. When I've seen people get into recovery, and it was in atrocity, talked about more in atrocity, the sort of need to feel a sense of purpose. And so it's not just about Suboxone or Sublocade, it's also about community, it's about a sense of purpose, it's about also a feeling of accountability. You're not responsible for your trauma, but an accountability for your actions. And that can get lost in what seems like support, but can be, for lack of a cliche word, enabling, as opposed to really working towards a recovery. The Rapid Access Addiction Medical Clinic is only open 4 days a week, and only open somewhat whole days, 2 of those days, but by whole I mean like 8:30 to 3:30. And we've already proven, there's significant evidence that you should be able to get response within 24 hours, preferably within the first day. We don't have that. There is a virtual clinic that has started, it's called Rocket Doctor, that does exist. It did better during the pandemic when virtual was accepted, and then they weren't paying virtual. I think they're paying it again. It's complicated. There also are other, for some people, with opioids, methadone is the right response. And I know Clinic 528 can get negative feedback. I can tell you the people I know that work there are absolutely amazing, and some of the most compassionate people I've ever met in my entire life. Same with that Clinic 217 in St. Thomas and the Rapid Access Addiction Medical Clinic. We need a lot more of them. Now, as far as, for some people, they need groups. Some people do respond really well to NA and AA. Some don't. I've actually recently had somebody who said that they couldn't, that every time somebody talked about their trauma, it traumatized them and that put them into relapse. So that environment works for some people and not everyone. And people have to find where their environment is that works. For residential, where some people do need that. They need to have a safe environment where they are able to really work on their recovery. And there are places, but there are not nearly enough of them in this area. And many of them involve getting referrals from Addiction Services of Thames Valley. So all of those things are things that we need more of. I will say, for some people, the gateway is with harm reduction. But I also think it's, and that's not something we can forget, that they need to be able to get into harm reduction, to be able to get into recovery. And that can be an important step in people's journey. I think the coordination with recovery programs and treatment programs needs to be enhanced. And recovery has to absolutely recognize that it's not just a medication, it's not a medication. It has to be a encompassing thing that includes all of the things we've talked about and includes an ability to engage family as part of that as well.
Thank you.
Okay, I have a last question, or?
Yeah. Sorry.
Okay, I got Rosemary over here,
Oh.
but I always feel
Sorry.
badly, but I do want to be respectful of everybody's time, so. You go ahead, I think she was first, I apologize.
Sorry.
Yeah, go ahead.
Okay, sorry. I just want to say thank you for being up here and talking to us, especially you as well. It takes courage. And I want to say, and for you as well, thank you for making the documentary and for you for being in it. I hear you. I hear you. Thank you for what you do, sir. We could talk about you know, possible solutions. We could talk about we need more of this and more of that. But I want you to think for a minute and change the way you think. Because we can point fingers. When you point, you've got 3 pointing back at yourself. But I want you to think this way. Those of us that are here tonight have a deep concern for our area. I'm from Woodstock, and I can tell you that those pharmacy those clinics, they're on their way to Woodstock. They're coming to Woodstock. And I'm going to be for running, making some noise. But anyway, we're all here because there's a concern. Now, you'll soon find out that part of what's happening is on purpose. This is an agenda. This is an agenda. You are part of putting out the agenda. And if you really want to test it, start speaking about this to the mayor. And when their reaction is, you lose your pay, you know he is one that will benefit off of the destruction of London.
That's right.
Okay? You will know that the public health lady is also going to benefit off the destruction of London. If you don't believe me, bring this up to her and watch her go for your jugular. Those who scream the loudest have the most to lose. And so when we can switch our thinking, and your higher up police officers, your chiefs, they are the problem. Your RCMP, higher ups, they are the problem. When we see the people rise up, the people, their biggest fear is that we all know what they're doing. And so all we need to do is let them know, and even if that means sitting quietly at a council meeting, saying nothing, your presence at a council meeting speaks louder than you can ever think. So I want to just encourage you that when they do come after you, you are over the target.
It's on my wall. Okay, thank you. I really appreciate your comments.
And just to end that, I want to say thank you, because you said everything was right. But I want to know how we get this out to places and people and more people so they know what really is going on. How do we get a movie like this? Do we try to get a movie out to areas in London that we don't know anything?
This movie is available online for free. This one here that you watched tonight.
How do they know that? I mean, every information out to the masses.
Rosemary, are you referring to the information in this movie in general?
For them to see that movie and trust both.
Yeah, well, they have been doing several screenings of it, and I gave you guys letters that were located over there. If you didn't get one, put your email address down, and I will send those out. The more public pressure, just silent glaring. The more public pressure they receive, the more they will bend. Right?
The more they get scared.
The more they get scared.
You're giving me information to give to the people that aren't going to listen to me. I want to know how to find people like this.
Well, I'm talking about the people who you say aren't going to listen to you, but they will listen to you. The more people who do this, they will be forced to listen. They will be forced to listen. And how to get this information out? We keep doing things like this. And actually, I had about 200 people express interest in coming tonight, but of course, obviously not everyone actually comes. But I can guarantee you, we can do this stuff again, and we can keep doing it, and keep doing it, and don't give up.
But you also wear out the people that have to keep coming and answering the questions.
Well,
I'm trying not to be negative here. However, it's true. So how do we get it to the masses as fast as possible?
Well, I'm answering these questions, but maybe these guys have alternative answers.
I just thank you for that question, and yes, I am somebody who does have to go home because we haven't had lunch yet.
No, eat those cookies, man.
My husband's got to get home before he falls asleep. But I think that everyone here needs to talk about this movie to people that they know and get them to see it because it is online. But I also can say, having gone through this since 2019 when I was attacked and called a liar and called many things that were worse than that, but stayed steadfast, because when you're telling the truth, being called a liar doesn't shut you up. I've really seen an absolute change, and to be honest, I think that when the chief of police came out and talked about having almost 12,000 diverted drugs found in 6 months last year, that actually really helped change the conversation. I'm seeing the conversation change. I'm really seeing the groundswell change. People are recognizing that what we're doing isn't working, so they're starting to ask questions of what is it that we're doing that isn't working, and this is part of what it is. So I'm already seeing a significant difference in kind of what the population knows, and we do need to get the message out there more, because I actually think governments do respond to when there's a groundswell and public opinion changes, so too can policies change, and I've watched that all my life, and I really believe that we can make a difference, particularly that there's a lot, it's complicated, but I think we're already making a difference.
I think so too.
And,
I really think so. Believe me, since 2020, I've seen our numbers increase exponentially. Really, we are making a difference. You just have to be persistent.
Yes.
Anyway, I would really like to thank all of the people who came out in the panel tonight. They were awesome, and I don't know, you're right, we're going to tire them out, but they don't have to do this, but I'll keep doing it. And I have a feeling they're not going to give up either. Right? Okay, so once again, give them a round of applause. We're doing this for free, man. Right? I'm not paying them a darn thing. I don't know if they expect it.
And a thank you to Tanya for organizing.
And a thank you to Susan for putting up with me.
I'm happy to thank you, and I'm happy to ask you a silly question.
Great job.
Finish back